Okay, alcohol poisoning. And that is the reason that all of us sitting in this room should understand alcohol poisoning, and it's very unique to our country. It's very, very unique to our country. It's unique because of the fact that alcohol is something that goes with tradition in our country. It goes with tradition. So there are Hindu cultures and Hindu traditions where you drink and drink and drink till you drop, isn't it? There is, it's called gatari or whatever it's called as. Where you drink until you drop. They have that. It's a tradition. Holi is a tradition where you drink and you drop, isn't it? It's like a part and parcel of our culture. It looks like. Even on a wedding, if you go, a wedding is not, the Punjabi wedding is not considered complete unless the person drinks and maybe vomits in his own funeral pyre or his shadi ka pyre ke andar. Literally, I'm telling you, that's the situation you have. If you've gone to a Punjabi wedding, all my friends, I mean not all Punjabi weddings, but my friend Punjabi weddings, I have not had the groom without vomiting. It's always been like that. It's crazy actually. In fact, Keralites. What about Keralites? They drink so that they can fall down. Keralites don't drink because they feel the taste is nice or they want to get high. They drink so that they fall. You see, the only disciplined line in a Kerala culture is when to buy alcohol. So if you go to buy alcohol, there will be a nice line, proper way standing one after the other for alcohol. You know this? It's there in Kerala. Okay. In Kerala, you can't buy alcohol unless you stand in a line inside that place. You go to a registration office, everyone will be jumping together. But only in alcohol, you'll see the most disciplined people in the entire Kerala. Isn't that the culture? No, I tell you, I was going for my wedding. For my wedding, I want to buy alcohol. In my wedding, my own wedding. Okay. So in my own wedding, we want to have alcohol. So I told my cousins, alcohol lana padega. Bahut sare jana aa rahe hain. I had taken my whole class. 40 of us in a train to my house in Kerala for my wedding, because my younger brother didn't want to really get married in a big way, and my father had only me to play around with. Okay, so they decided that we will have alcohol, and so I told my cousin, my cousin is from Kerala, not my cousin from Kerala, so I told my cousin to need to buy alcohol. So they took 5-6 people along with me. I was wondering why 5-6 people, because you have to stand in the line and given a quota.
Okay.
I can't buy 10 and 12. So you can buy only 2 or something. So all of us went as a 10 people, 10-15 people together, everyone carrying 2 bottles. And in a straight line, I was surprised to see the line, straight line, I was standing in the middle. It was amazing. And frankly, after that, I actually Googled to figure out which is the most disciplined area in Kerala, and it actually came out to be alcohol. It's actually there on Google. It's actually there on Google, any which ways. So that's why we should know alcohol, because it's intimately related to India. It's very intimately related to India. When you say alcohol, there are 3 kinds of alcohols that we talk about. Okay, there are 3 kinds of alcohols. One is called as methanol, the other is called as ethylene glycol, and the third is the usual ethanol. Okay, so you have methanol. Okay, the first alcohol we talk about is methanol. Okay, the other that we have is ethylene glycol, and the other is called as the usual ethanol. There is also the isopropyl alcohol, but however the isopropyl alcohol is not as common as ethylene glycol and methanol. Now, where have you heard methanol? Where have you heard methanol? Sorry? So methanol is something where you have called as moonshining. What is moonshining? Anyone? Moonshine? Anyone knows what's moonshine?
Moonshine is
Correct. Moonshine is tadi. Moonshine is those distilleries where you don't need to really, it's not regulated. It's not regulated. That's called moonshining. Abroad, all over the world, it's called moonshine. Okay, moonshine is those distilleries where things are not regulated. They do things which we don't know what they're doing, and they intoxicate the people because of the wrong concentration that they add, and the wrong concentration that they add is of methanol, because it's very cheap to buy methanol. Very cheap to buy methanol. It's usually seen in antifreeze solutions. It is seen in your brake fluid. It is seen in your engine, your carburetor of your in vehicles too. It's also very commonly seen in detergents. So it's seen in a many amount of fluid that you can buy. An antifreeze solution also has something called ethylene glycol. Okay, it also has ethylene glycol. So very easily available solutions these are, which are adulterated with the usual alcohol to call it as moonshining. Okay, so recreationally it can be given. Recreationally. So one of the forms of toxicity is recreationally. That means there is a wedding in the family, they want to get alcohol, and alcohol is expensive, so they adulterate it, and that's one of the commonest causes of alcohol toxicity in our country. When in the villages, in the tribal areas, they don't get this usual distilled alcohol. They make the alcohol and they add methanol into it, which thus makes it moonshining. This is called recreational. The other one is accidental. Okay, accidentally it may happen that there's a small baby who wants to drink water, neonatal and pediatric age group, where accidentally the person drinks a high amount of hard alcohol. The young baby, maybe 1 year old, 2 year old, drinks a high amount of hard alcohol. It's lying in the house. That's why we say, our parents say, when you have children at home, don't keep alcohol around. It is not like that only. It is actually the right thing to do. Because if he has that small amount of hard alcohol, that particular pediatric baby has a small amount of alcohol, what does that baby know? He will go into toxicity. Correct? So that is accidental ingestion, very accidental ingestion. And the other is suicidal ideation. So there are people who say, I will drink and die. I will drink and die. There are such people. And they will drink, and they will actually die. Because they feel like if I drink a lot, they will die. And so they drink. So suicidal ideation. So there is suicidal ideation. There is recreational drinking. And the third would be accidental ingestion, which actually causes these patients to actually get into toxicity. Right? So you have a patient who comes in with suspected alcohol poisoning. You're suspecting some kind of drink that is had which is not garlic odor. Okay, if it's a garlic odor, you normally think of organophosphorus. You normally think of, when the kerosene type odor, you think of organophosphorus. But you have a person who comes in, it doesn't smell like organophosphorus, and there is no history that he has taken some poison. Organophosphorus naturally is called as poison. Organophosphorus naturally called, anyone who's taking organophosphorus say poison liya usne. But that's not the scene when it comes to alcohol. Okay. So what would you send in your first instance? The patient has come in. What would you send in the laboratory? What would you send? What do you send in the laboratory? Laboratory, what are you? Okay, you have a patient who's coming to you. He is kind of conscious and talking to you, but he's a little bit wonky. He's not able to stand properly, and he's come to you. And they're bottom over here. What are you going to send? Laboratory wise.
Blood levels.
What are you going to send? You have to send something. What are you going to send? What are the investigations you'd like to send in a person who has come to you with an inebriated state?
Blood level, toxin, alcohol.
I will first send my usual levels, please. Not CBC. Not CBC. What when I'm looking at poisoning? Calcium, magnesium, phosphorus. I will send my calcium, my magnesium, and my phosphorus. Essential sodium, potassium, calcium, magnesium, phosphorus. I will not do this. This is one of the things that I will do, because we know what we know. With respect to alcohol, there is hypocalcemia. With respect to alcohol, one of the pointers towards alcohol poisoning is hypocalcemia. Clear? Another pointer towards Wernicke's encephalopathy is hypomagnesemia. Correct? Another pointer towards this is hypomagnesemia. And that is the reason that I'm going to send my calcium, magnesium, phosphorus, sodium, potassium to rule it out. Sodium, potassium, why? And phosphorus, why? Because these patients may have diarrhea and diuresis, which will cause either hypovolemic hyponatremia, hypokalemia, or hypophosphatemia. Clear? So you understand why I'm sending? So my first investigation that I would like to send in these patients would involve calcium, magnesium, phosphorus, sodium, potassium. These are the things I want to send in my patients. This is very essential that I send sodium, potassium. You understood this? Why I'm sending this? Correct? Because calcium, again I repeat, can be a manifestation of alcohol poisoning, because it is known to cause hypocalcemia. Magnesium, because Wernicke's encephalopathy in a chronic alcoholic is generally precipitated by hypomagnesemia. Phosphorus, because sodium, and potassium also because these patients have excessive vomiting because of gastric irritation and diarrhea, which leads to electrolyte imbalances like this. Correct? And that's why I want to send these things when it comes to any kind of poisoning in which there is inebriation. Okay? What is the next thing you want to do? That's it. Sneha, you want to answer?
LDH
Sorry?
Some enzyme level which.
What do you want to say? Anyone? So what do you do in ABG? Want to do an ABG? Why do you want to do the ABG? when you're looking at alcohol, who are looking at ABG? Any idea? Any idea? Huh? So what happens? What happens? What happens in
Ion
alcohol
gap.
poisoning is you must understand. That's why you want to send the ABG for.
high anion gap metabolic acidosis,
Ah.
poisoning in
Sorry.
metabolic acidosis in methyl
So
poisoning,
if you have a high
salicylate.
anion gap, if you have a high anion gap, and you have taken off uremia, diabetic ketoacidosis, lactic acidosis,
Salicylate poisoning.
it will actually figure towards alcohol poisoning. If you have a high anion gap, and you have taken off all the rest of the mud piles that we know about, in mud piles, methanol is the first
Yes,
one,
yes,
and then you have
methanol.
uremia, diabetic ketoacidosis,
Salicylate
paralytic poisoning,
Salicylate
correct, salicylate poisoning. You actually do that, and that is also the reason that I want to send
Maybe.
salicylate levels and paracetamol levels, because that also causes high anion gap. You got the point? The reason that I want to do the paracetamol levels and the salicylate levels is even that causes high anion gap. So that means I am doing an ABG to figure out whether I have high anion gap metabolic acidosis, and when I am doing high anion gap metabolic acidosis, I am ruling out everything else, which includes salicylate and
Potassium.
PCM. Clear? Clear on this? So you understand the rest of the investigations what I am sending? But also what I have salicylic acid and paracetamol. Also I do the ABG for one more reason. Can anyone know, does anyone know what's a lactate gap? What's a lactate gap? So this is one of the gaps you should know, lactate gap. What's a lactate gap? I'll explain to you. No, lactate gap. So I'll explain to you what's a lactate gap. Okay. Now, there are two kinds of ABG machines. One, last time we discussed ABG. At length we discussed ABG of how, you're able to now solve, you saw how we solved that ABG, how simple it was to solve ABG. All the three ABGs that we solved yesterday was very simple to solve. Please solve the ABGs to get used to what I taught you all. Okay, please solve it the way I told it, because it becomes easy then. Okay, I solved all those, the nurses solved all those ABGs. Alright. So now, you are not solving, you should solve. I'm telling you again and again. Okay? So ABGs are done by two methods. One method is when you send it to the laboratory, and the other method is when you do it on the bedside. Okay, we don't have the bedside method, but the bedside method is called the POC. If you remember, when we were doing the liver transplant, we had a bedside method. When you were doing liver transplant, there was a small machine that was given to you in the liver transplant unit. That was a bedside POC, that is the point of care for ABG. So bedside. We took the blood, we put it in that, and that gave you an ABG. It was a bedside technique. Whereas the other technique is when you send it to the laboratory. Now there is a big difference between both of those. I'll explain to you what. So you have the POC where it is called as ISTAT, it's called as EPOC. These are the various names. What we had over here was the EPOC. What we had over here was the EPOC. Okay. And you have the laboratory method, where you send the usual blood gas to the laboratory. Okay. Now what's happening over here is most of these ethylene glycol gets converted to acetaldehyde or whatever that aldehyde is, and then gets converted into glycolic acid. It gets converted to glycolic acid. It gets converted to glycolic acid, and once it gets converted to glycolic acid, the next thing is glycyl oxalic acid. And then it gets converted to glycine and oxalic acid. This is the usual passage. Ethylene glycol gets converted because of aldehyde dehydrogenase, finally to a glycolic acid, and then to oxalic, then oxalic and glycine. Clear? This is how it gets converted. Clear on this? This is how the conversion occurs. Now, what happens to your blood gas machine on the in the periphery is that your blood gas machines which are there, the EPOC machines are there, no? They actually pick up this. They pick up this as lactate.
Glycolic acid.
Yeah, they look at that glycolic acid element and they pick it up as lactate, the POCs, the point of care. Okay, and you will find the lactate to be alarming high in the POC. The same you do it in the laboratory. The laboratory picks up the lactate as lactate dehydrogenase, LDH. Clear? So this means to say, if you have a discrepancy in your POC of lactate and the same in the laboratory is kind of normal, then you can attribute this to ethylene glycol poisoning. because lactates are not going up in ethylene glycol poisoning. Are you getting the point? Mud piles, right? MUDPILES. Lactic acidosis should not be there when you're looking at ethylene glycol poisoning. High anion gap, methanol it should be, right? There should not be lactates. You got the point? Huh? So if I do a blood gas analysis on the POC and a point of care, and I find lactates that are elevated, what is that lactate actually?
Glycolic acid.
You got the point? Clear? Huh? So that's one of the uses of using a bedside POC. It gives you an idea that okay, that in a lecture from US. So you can tell very clearly that this is because of glycolic acid. ठीक है? समझ में आ रहा है मैं क्या बोल रहा हूँ? Clear? Any questions till now?
तो उसका यूज क्या है सर? मतलब ग्लाइकोलिक एसिड की वजह से लैक्टेट है तो
मतलब क्या हो गया?
What it suggests?
मेरा डायग्नोसिस आ गया ना कि दिस इज इथिलीन ग्लाइकॉल पॉइजनिंग। आप लोगों को बेडसाइड डायग्नोसिस
Bedside
चाहिए
diagnosis,
कि भाई ये क्या है? So when I'm doing ethylene, when I'm doing a bedside EBG, I'm getting lactates to be elevated. This means what? And I'm sending it to the laboratory. Lactate is normal in laboratory. That means lactate is not really elevated. What I'm finding as lactate in the epoch elevated or the POC elevated is actually glycolic acid. So glycolic acid is coming from where? From ethylene glycol, poisoning say. You got the point? So you can actually figure out this because you're going to take a long time before you get ethylene glycol levels. And that brings to the story, when you actually send for volatile alcohols, ethylene glycol is not included in volatile alcohol screens. When you send it for laboratory and you tell them I want alcohol levels, you have to specify, na? It cannot be just alcohol. You understand? So उसमें panels होते हैं, तो उसमें एक panel होता है volatile alcohol. Correct है? ये volatile alcohol में क्या आता है? Ethanol, isopropyl alcohol, methanol, but ethylene glycol will not be there. So you have to send ethylene glycol separately if you are looking at alcohol poisoning. You understand what I'm saying? So on the bedside, if I want to send levels, so this is completing my investigations. You understood why you want to do the ABG? You understood why you want to do the ABG? Huh? Okay. Of course, the ABG doesn't just give you about alcohol; it gives you a whole lot of other things. So if the patient has been taking nitrates and things, they'll give you methemoglobin also, isn't it? It will give methemoglobin. The nitrate toxicity is there. It will give you amyl nitrate, cyanide, everything. Right? But for the purpose of alcohol poisoning, I'm using it for the lactates from the point of care. Clear on this? And so that's why when you're also sending the levels, I'm going to send ethanol, I'm going to send methanol,